Hello, I am reporter Miranda Christian, and thank you for watching. I am joined this afternoon by Senator Tina Polsky, and we are going to talk about a situation that had happened over the last couple days that is now making headlines everywhere all across Florida. And Senator, I guess first off, we'll just dive right in. I know you were just diagnosed with breast cancer. How are you doing? How are you feeling? Can you tell us a little bit more?
Sure. Nice to be with you, Miranda. I'm doing okay. Thank you for asking. I'm actually starting radiation treatments tomorrow. I was at the radiologist this morning preparing, and so it's been really pretty hectic. We were in Tallahassee last week, as we all know, and so it's been a lot to juggle. I'm right now feeling okay. Hopefully, the radiation treatments don't leave me, fatigued or any other symptoms. So, we're keeping our fingers crossed, but right now I'm okay. Thank you.
And I thought I read you had just had surgery as well.
Yes, a few weeks ago I had a lumpectomy.
That's coincidentally, we're in October, which is Breast Cancer Awareness Month. I mean, I know it's a lot of emotions for women during this month, those who are fighting and current fighters and survivors. I mean, going through this, going into next week, that's a lot to go through while also being a senator.
It has been a lot. I decided to go public with my diagnosis, maybe a little sooner than I wanted to. The word was kind of getting out, and also it is still October, and I thought it was important to share my story. And already by being public, a couple of people told me it reminded them to schedule their mammogram. Someone had the doctor look at something that they were uncomfortable with. So that's really my goal, is to spread the word and advocacy for women to get their mammograms and do their self-examinations, but especially women under the age of 40 who aren't supposed to get mammograms. They have to be really diligent in their self-exams because they have no other tools at the moment. And so I really wanted to bring awareness. Sometimes those women have more aggressive kinds of breast cancer, and the sooner you catch it, the better the outcome and the less treatment that you need. So, for those women, if you feel something, say something, please. It's really, really important.
Thank you for sharing your story and information with us. And I guess we'll dive into, tell me about this meeting with the Surgeon General. Why were you having it? What was it going to be about?
He requested the meeting with me. The senators have to confirm his position. It doesn't have to be this session. It could be next session, next year. But I don't know when he's being put up for a vote. But he does have to get all the senators, there's only 40 of us, to get our confirmation. And so it's very typical that when the governor appoints people to agency heads or different positions, even to so many boards that we have out here in Florida, that the Senate gets to confirm them. So it was sort of a matter of course that he would go around to meet people. I might have been on the earlier side of it because I'm on the Ethics and Elections Committee, and we might see him sooner than the other senators. So he did request the meeting with me.
Can you tell me what had happened? I'm sure you told the story several times now, but can you tell us what happened?
Yes, I have a sign outside my door, please wear a mask inside. I have masks available. I've held dozens of meetings in my office, and I've asked everyone to wear a mask, and not one person has ever refused. Part of what we do in the Senate or in the House is hold meetings with advocacy groups, with different interests, with constituents, with other people in the government. And so it's normal. With my diagnosis, before I went up to Tallahassee, we decided that the safest course of action for me to not catch any disease or COVID in particular is to make everyone mask up. My office is not that large. We kind of sit around in a circle. There's not 6 feet between us. Usually they come in multiples, and the Surgeon General came with 2 aides, and I have 2 aides. So it would have been a lot of people in the room, and that is why I ask everyone to mask up, and everyone has respected my wishes except for the Surgeon General.
How did that conversation happen? Was it just a right away when he walked in? What was the demeanor? What was said? How many times did you ask? How did this all kind of go down?
So I actually came into the office when he and his 2 aides were already there. and they were kind of standing around in the waiting area, which is not that large either. And I came in and said who I was and asked them to please, I had my mask on, if they could, and my aide did, can you please put the masks on? And he says, I don't do interviews with a mask. And I said, I can hear you perfectly fine. And he said, well, why don't we go outside? I said, I am uncomfortable doing that. I have a comfortable office here. I'd like you to put on a mask. That's what everyone else does. And let's have this meeting. I have some questions for you. And he refused. And unfortunately, it went on too long. I really wish I had cut it off. It was, over 5 minutes of some kind of negotiation. I asked him why he can't wear a mask. He didn't answer it. His attitude was, in my opinion, smug. And I think he was enjoying himself, especially based on the comment he made after he left the office. That was overheard by my other aide outside in the hallway, that he was kind of pushing my buttons on purpose. And he wouldn't comply with the very simple request to wear a mask for the 10-minute meeting that we would have had. I did tell him I had a serious medical condition. I didn't say what it was, and he still didn't care. He kept trying to negotiate, and I just said, I need you to wear a mask. I kept backing up into my aide's office. I was so uncomfortable being so close to these 3 people who weren't masked, and it just went on too long, and I should have asked him to leave earlier. But finally I said, I know everything I need to know. Can you please leave now?
I guess why not take the meeting outside or try to do it over Zoom? Or is that where it was just that you couldn't reach that decision?
The outside is not right there. It's stairs or elevator. It's uncomfortable. It's hot. We have metal picnic benches outside. I just didn't feel that was what I needed to do. He came to my office to meet with me. I have a comfortable setup. I have masks available for everyone. If he wanted to meet with me, he should have respected me and my health. Even if I didn't have any kind of diagnosis, he still should have respected my wishes. No one else has had a problem. It was, the utmost of unprofessionalism for him to not respect me as a senator. He requested the meeting. It was the most simple request. There's no reason that he told me why he couldn't put a mask on physically. And so out of respect for me, he should have had the meeting where it was designed to be.
And I know since then, there's been several articles, as we said, a lot of headlines with this. And I know the Senate president came out with a statement. When you saw that, knowing that he is a Republican, you're a Democrat, knowing what happened in these discussions and how political it is, I guess, what was your reaction to that statement and email that went out?
I was very pleased and grateful that Senate President Simpson put out that statement to support me and to support the Senate as a whole. We are a strong body. There's only 40 of us, and we all have a lot of respect for each other. Obviously, we have big political differences, but when it comes to decorum, when it comes to kind of things outside the political sphere, we're very protective of each other. And I was really appreciative. And I think it just goes to show how serious an offense this was for such an important position. I mean, we're not talking about, an election supervisor or something, other than public health. And so for the public health leader to not care about my health really says all you need to know about him.
Do you think now, are you hoping, did you expect this to get the attention it's getting right now, or are you glad it's getting the attention it's getting?
I personally was not seeking publicity. I'm a little uncomfortable with that, but I'm doing these interviews because I think it's really important to get the word out. I would be very unhappy if this person was the Surgeon General, the lead public health officer in our state. Imagine the next public health crisis if he ignores scientific evidence, if he ignores the proven formulas to help the health of Florida. I would be very uncomfortable with this man being in charge of that. I don't like his response to COVID. He questions vaccines. He hates masks. And those are the only tools that we have right now. He's not offering any other tools to help us. So I don't understand how he's going to protect the health of our state and be the number one person in charge of that. So I think he is unfit for the position.
Is that what you would like to see moving forward? Is there any change or any sort of further discussions you'd like to see moving forward?
I'd like to see the governor take away his nomination and support someone who believes in science and believes in the proven health, answers that we have to COVID. And this person does not.
Do you think, and I know you had mentioned because you were going back to Tallahassee, knowing your diagnosis, had you been asking people to mask up before, or is it kind of extra vigilance knowing you're about to go into, radiation, going, fighting cancer? Was that extra masking up, or was that something you were already doing?
I mean, I personally try to be really careful. I wear masks in stores. When I'm out in a group, we have events up in Tallahassee. I wear a mask. I'm usually the only person wearing a mask. But I had not been in Tallahassee before my diagnosis. So in other words, our committee weeks just started a few weeks ago. I missed the first committee week because of the surgery. And so I've only been there 2 weeks, and I had my diagnosis ahead of time. And so in planning how we would do my schedule with my staff, we decided, let's put a sign up. Let's make sure we have enough masks. We ordered some more. And that's how we've proceeded ever since these committee weeks began.
And next week, you said tomorrow, your radiation starts tomorrow. I guess how long of a process is that going to be? I can't remember if you mentioned how many treatments you'll be doing.
Yeah, I'm scheduled for 5 treatments over 10 days right now.
Well, Senator, the best of luck to you. I know that a lot of people were sharing their prayers for you and what is going on. I thank you so much for sharing your diagnosis with us and your story, especially in the month of October. And thank you for joining us and talking about what happened.
Thank you so much for having me. And please, everyone, schedule your mammogram.
All right. Thank you, Senator.
Thank you.